Rebecca Moe, an ER nurse at UHC. Today we're going to talk about administering TPA, or Activase is another name. You're going to give these patients obviously to a patient that's had a non-hemorrhagic stroke. You're going to get your order from your physician. You're going to make sure that in ER we have a little packet for patients that are getting TPA. It includes the contraindications, patients that have had any recent surgeries or a recent hemorrhagic stroke or an old stroke. Those are all things that the physician needs to consider when ordering TPA for a patient. So you're going to make sure that all of these were reviewed with your patient and that your consent has been signed. Then you're going to go get your medication. You want to make sure you do a good neuro exam on your patient before the administration of the medication. When you get the box, you're going to have 2 vials in it. You're going to have your liquid and then your medication. You're going to need to get a transfer device for this. And you want to make sure early on, I accidentally poked in my liquid first, and then if you put it over, it's going to go everywhere. So you want to make sure that your liquid is stable and that you're going to puncture your medication vial first. You're going to invert it, and then you're going to let the liquid all pour back. You want to make sure that you're not shaking this medication. You want to make sure all the liquid is going down into your vial. Once all the liquid is there, you're going to remove this, and you're going to swirl. Never shake this, you're going to swirl. It's going to take a few minutes to make sure that all the medication is mixed. Just swirl it, swirl it, swirl it while you're getting everything else together. So this medication comes with a handy dandy dosing chart. We have the dosing chart up here as well to help you. The medication dose is going to be 0.9 milligrams per kilogram, so you want to make sure that you have a very accurate weight for these patients. You're going to look at your chart once you get your accurate weight, and it's going to tell you your total dose, what you're going to discard, your bolus, and your infusion. So let's say we have a patient that is 80 kilogram weight. It shows you that your total dose you're going to give is 72 milliliters. For this patient, you're going to discard 28 milliliters. You want to make sure that 2 nurses are drawing out of this vial how much you're going to discard. You don't want to accidentally administer the whole vial. So you're going to pull out, for this patient, it will be 28 milliliters. When you're drawing it out, there is a side port that you want to inject. You don't want to go through the same hole that the spike went through, because it's going to start spilling all over the place when you push it out. So you want to make sure that you're injecting on the side, you're drawing out your dose, and you're discarding it, documenting it with 2 nurses. Once you have that out, there's going to be a bolus dose. For this patient, it will be 7.2 milliliters. You're going to give that over a minute. You can set it on the pump to give it from the vial. I like to draw out the bolus from the vial and just push it over a minute. The rest of your dose is going to be given over an hour. So this patient would be 64.8, and you would give that over an hour. After that hour is finished and that dose is done, you want to hang a little bag of saline behind it. Remember, you still have dosing in the tubing of the medication, so you want to make sure that you're flushing it all out. You're going to hang a little bag of saline and just flush it out at the same rate until you know that you have all the medication for the patient. During the administration, you want to make sure that you're staying with your patient, that you are assessing vital signs, and you're assessing neuro and bleeding every 15 minutes. You're charting that. So you're going to be constantly looking at your patient, charting every 15 minutes. If your blood pressure gets too high, you want to make sure that you're alerting your physician. If you're seeing declining, the patient's neuro status is declining, you want to make sure that you stop your infusion and immediately notify your physician. Any improvements as well, you want to make sure that you're documenting well. You're going to be assessing for signs of bleeding. If the patient starts having any problems, you want to make sure you're notifying the physician. So once all of that is done, you want to make sure that the patient has received good education on assessing for signs of bleeding, things that the family and the patient need to alert the nurse to right away if they're concerned. And that's it for TPA. Thank you.